The member for Burlington.
Thank you, Mr. Speaker. I'm pleased to stand in the House and have the opportunity to join this very important conversation and to talk a bit, if I may, Speaker, of the good work that our government is doing to improve healthcare services for Ontarians with a rare disease or disorder. I'd like to recognize the member from Kitchener-Conestoga for his continued advocacy in this area, and I'd like to thank the organizations, patient groups, and Ontarians who have a rare disease or disorder, as well as their friends and families, for their work on this issue. And I know, Speaker, that many of them have joined us in the gallery today. Thank you for being here. Our government is committed to putting patients first, which is why our recent budget includes increases to healthcare spending by $1 billion, including $345 million in hospitals, to ensure patients receive the right care at the right time and in the right place. Understanding the experience of those individuals who use our healthcare system is essential to this commitment, because when we understand their experiences, we can make the changes necessary to our system to meet their needs. Our government knows that there are many Ontarians living with or who have family members living with rare diseases or disorders. We also know that because these conditions are rare, they can often be misdiagnosed. The effect of this is that these Ontarians face challenges in their ability to access appropriate care. We recognize the hardship and stress that this can cause and the impact it can have on people's everyday lives. We recognize, too, that we need to take action, and I want to assure Ontarians living with rare diseases or disorders and their families that this work is underway. As a government, we have done much to improve access to care for these individuals, but still more needs to be done, Speaker, and that needs to be acknowledged. And our goal has been and continues to be to offer the best possible care to help them. The Minister of Health and Long-Term Care has been working hard with partners across Canada, leading a working group to develop a pan-Canadian rare disease strategy. And as a clinician, he not only empathizes with those and their families who suffer from rare diseases, he is committed to working with colleagues from across our country to strategize possible solutions. Just this week, on International Rare Disease Day, on Monday, February 29th, the Minister announced further steps to better serve Ontarians with rare conditions. Our government shared the report of the Ehlers-Danlos Syndrome, or EDS, expert panel with the public. In response to the panel's recommendations, our government is creating a new Centre of Excellence clinic that will focus on diagnosing and treating adults and children living with EDS, a group of inherited disorders that affect your connective tissues, primarily your skin, joints, and blood vessel walls. This new clinic would strengthen care and support for individuals and families living with EDS by offering primary care providers a single point of contact to receive information and guidelines on related signs and symptoms. It would also provide advice and feedback from clinical experts on diagnosis and treatment options, as well as make referrals to specialists, including geneticists, pediatricians, and pain management professionals. The Minister also announced that the clinic could be expanded to support primary care providers treating people with other rare diseases if required. Further to the announcement of the clinic, our government announced that we will be creating a working group comprised of Ontario experts to explore how services for people with rare diseases and disorders in Ontario can be improved. The group will look at improving early detection and prevention, providing timely and accurate diagnosis and care, and improving community supports for patients and their families. Issues such as this require advice and input from experts in the field and those with clinical experience, which is exactly the reason this working group will be made up of both. I'd like to take this opportunity to share an excerpt regarding our government's recent announcement from the Canadian Organization for Rare Disorders, or CORD. The Canadian Organization for Rare Disorders welcomes the announcement made by Ontario Health Minister Eric Hoskins to open a new clinic for patients with EDS, which could be expanded to other rare disorders, as well as his commitment to strike a working group to develop an Ontario approach to a coordinated provincial healthcare system for patients with rare disorders. Their president and CEO goes on to say, Minister Hoskins' previous effort on behalf of patients with urgent and underserved needs gives Ontario families with rare diseases great hope that his leadership and commitment will inspire other stakeholders and offer an example for other provinces." End quote. I take pride in the support shown to our government, that quote in particular, for our work in this area by organizations such as CORD. It reinforces our commitment to putting patients first and acknowledges our hard work on developing a plan of action. In closing, Speaker, I'd like to acknowledge an outstanding advocate in my constituency, Lynn Clark, who came to see me recently about the need for our government to work towards an approach on rare disorders. Lynn sits on the board of the ILC, or the Improving the Lives of Children Foundation, based in Halton Region. She attended Minister Hoskins' announcement as a result of her passion for and commitment to finding solutions for patients. Her experiences with her daughter, Chelsea Clark, a gold medal Paralympian, a young woman whose challenges with chronic pain were largely misunderstood, drove Lynn to become the passionate advocate that she is. I'd like to commend again the continued efforts by the member from Kitchener-Conestoga in advocating on behalf of Ontarians with rare diseases and disorders. He clearly shares our commitment to putting patients first and ensuring that their needs are met as quickly as possible by providing the best possible care. Our work in this area will continue, Mr. Speaker, because it must. And I look forward to working together with the member opposite and indeed all members of this House. And I want to underscore in closing, Mr. Speaker, that while we might not always agree on the mechanism for moving this forward, no one should take that as a sign or a commitment that our government doesn't care about this issue. In fact, we do, which is precisely why our minister looks forward to, as I mentioned, working with all members of this House to solve this very, very important and pernicious issue. Thank you, Mr. Speaker.